Seasonal affective disorder, SAD. Seasonal affective disorder, SAD, is a type of depression that's related to changes in seasons. Seasonal affective disorder, SAD, begins and ends at about the same times every year. If you're like most people with SAD, your symptoms start in the fall and continue into the winter months, sapping your energy and making you feel moody. These symptoms often resolve during the spring and summer months. Less often, SAD causes depression in the spring or early summer and resolves during the fall or winter months. Treatment for SAD may include light therapy, phototherapy, psychotherapy and medications. Don't brush off that yearly feeling as simply a case of the winter blues or a seasonal funk that you have to tough out on your own. Take steps to keep your mood and motivation steady throughout the year. Symptoms. In most cases, seasonal affective disorder symptoms appear during late fall or early winter and go away during the sunnier days of spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in spring or summer. In either case, symptoms may start out mild and become more severe as the season progresses. Signs and symptoms of SAD may include feeling listless, sad or down most of the day, nearly every day. Losing interest in activities you once enjoyed. Having low energy and feeling sluggish. Having problems with sleeping too much. Experiencing carbohydrate cravings, overeating and weight gain. Having difficulty concentrating. Feeling hopeless, worthless or guilty. Having thoughts of not wanting to live. Fall and winter SAD. Symptoms specific to winter onset SAD, sometimes called winter depression, may include oversleeping. Appetite changes, especially a craving for foods high in carbohydrates. Weight gain. Tiredness or low energy. Spring and summer SAD. Symptoms specific to summer onset seasonal affective disorder, sometimes called summer depression, may include trouble sleeping, insomnia. Poor appetite. Weight loss. Agitation or anxiety. Increased irritability. Seasonal changes and bipolar disorder. People who have bipolar disorder are at increased risk of seasonal affective disorder. In some people with bipolar disorder, episodes of mania may be linked to a specific season. For example, spring and summer can bring on symptoms of mania or a less intense form of mania, hypomania, anxiety, agitation and irritability. They may also experience depression during the fall and winter months. Causes. The specific cause of seasonal affective disorder remains unknown. Some factors that may come into play include your biological clock, circadian rhythm. The reduced level of sunlight in fall and winter may cause winter onset SAD. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. Serotonin levels. A drop in serotonin, a brain chemical, neurotransmitter, that affects mood, might play a role in SAD. Reduced sunlight can cause a drop in serotonin that may trigger depression. Diagnosis. Even with a thorough evaluation, it can sometimes be difficult for your healthcare provider or mental health professional to diagnose seasonal affective disorder because other types of depression or other mental health conditions can cause similar symptoms. To help diagnose seasonal affective disorder, SAD, a thorough evaluation generally includes physical exam. Your healthcare provider may do a physical exam and ask in-depth questions about your health. In some cases, depression may be linked to an underlying physical health problem. Lab tests. For example, your healthcare provider may do a blood test called a complete blood count, CBC, or test your thyroid to make sure it's functioning properly. Psychological evaluation. To check for signs of depression, your healthcare provider or mental health professional asks about your symptoms, thoughts, feelings, and behavior patterns. You may fill out a questionnaire to help answer these questions. Treatment. Treatment for seasonal affective disorder may include light therapy, psychotherapy and medications. If you have bipolar disorder, tell your healthcare provider and mental health professional, this is critical to know when prescribing light therapy or an antidepressant. Both treatments can potentially trigger a manic episode. Light therapy. In light therapy, also called phototherapy, you sit a few feet from a special light box so that you're exposed to bright light within the first hour of waking up each day. Light therapy mimics natural outdoor light and appears to cause a change in brain chemicals linked to mood. Light therapy is one of the first-line treatments for fall onset. It generally starts working in a few days to a few weeks and causes very few side effects. Research on light therapy is limited, but it appears to be effective for most people in relieving symptoms. Before you purchase a light box, talk with your healthcare provider about the best one for you, and familiarize yourself with the variety of features and options so that you buy a high-quality product that's safe and effective. Also ask about how and when to use the light box. Psychotherapy. Psychotherapy, also called talk therapy, is another option to treat. A type of psychotherapy known as cognitive behavioral therapy can help you learn healthy ways to cope with, especially with reducing avoidance behavior and scheduling meaningful activities. Identify and change negative thoughts and behaviors that may be making you feel worse. Learn how to manage stress. Build in healthy behaviors, such as increasing physical activity and improving your sleep patterns. Medications. Some people with benefit from antidepressant treatment, especially if symptoms are severe. An extended-release version of the antidepressant bupropion, Wellbutrin XL, a Plenzen, may help prevent depressive episodes in people